COVID-19 hospitalizations in Wisconsin are dropping. In fact, according to the Wisconsin Hospital Association, they are the lowest they've been since the association started tracking in April of last year, reporting only 186 hospitalizations.
In Eau Claire, hospital officials say they've felt the drop, but say we're not out of the woods yet.
A year ago, hospital care looked very different, all as a result of COVID-19.
It was a whole different world a year ago. You know, healthcare is stressful for our caregivers in a normal environment. Then when you add the pandemic on top of it a year ago, and really up to in the recent past year, it was very, very stressful.
We didn't know what to expect, what's going to happen. There was also a realization of how much of an impact it's going to have on our ability to take care of patients and the possibility of being overwhelmed.
We know how to handle mass casualties. We know how to handle highly critical events. That's what we do as a hospital system. But this was new. This was something that we didn't know what it was going to unfold, how it was going to unfold.
Now we do know, and now a year later, the Wisconsin Hospital Association is reporting the lowest number of COVID-19 hospitalizations since tracking began in April 2020, and a 92% drop since hospitalizations peaked in Wisconsin last November, with over 2,000 statewide.
Back at the peak of this, around November or so, we would have over 100 patients in our region within our system that are hospitalized with COVID. About 10, give or take, would be in the intensive care unit, most of them on ventilators. By comparison now, we're in a much better place. You know, overall, we have roughly 5 to 10 in the system.
Sacred Heart Hospital says their beds are still full, not as many as a result of a COVID-19 diagnosis, but as a product of postponed care as a consequence of the pandemic.
People didn't receive care, maybe didn't go out of their homes as much during the pandemic and delayed getting surgeries or having care.
Fear of returning to high COVID patient volume as coronavirus strains mutate have local hospitals pleading for COVID vaccinations.
So still out there, we're still seeing sick patients. Yes, it's not overrunning our system. Yes, we're able to function, right? But we don't even want one person to be in that position or potentially lose their life when we have a vaccine that's very effective and very safe.
That was Alyssa Lyons reporting. Now, the CDC still requires masks be worn at care centers like hospitals and clinics. Visitor policies do vary by hospital location.